Hello, I am Pharmacist. Today we discuss about pharmacology, uses, side effects, contraindications, pregnancy warnings, drug interactions, and dose of methicillin, nafcillin, and dicloxacillin. Pharmacology, methicillin, nafcillin, and dicloxacillin are all beta-lactam antibiotics that work by inhibiting bacterial cell wall synthesis. They bind to penicillin-binding proteins, which are enzymes involved in the formation of bacterial cell walls. This leads to the disruption of the bacterial cell wall, resulting in bacterial death. Methicillin is no longer commonly used due to its high toxicity, while nafcillin and dicloxacillin are more commonly used as they have lower toxicity and broader spectrum of activity against some gram-positive bacteria. Uses: nafcillin and dicloxacillin are used to treat a variety of bacterial infections, including skin and soft tissue infections, respiratory tract infections, and bone and joint infections. They are also used to treat infections caused by susceptible strains of Staphylococcus, including methicillin-resistant Staphylococcus aureus, MRSA. Side effects: the most common side effects of methicillin, nafcillin, and dicloxacillin include diarrhea, nausea, vomiting, and allergic reactions. Other side effects may include liver toxicity, kidney damage, and anemia. Contraindications: methicillin, nafcillin, and dicloxacillin should not be used in patients with a known hypersensitivity to penicillin or any other beta-lactam antibiotics. Pregnancy warnings: methicillin, nafcillin, and dicloxacillin are generally considered safe to use during pregnancy. They are classified as pregnancy category B drugs, which means that animal reproduction studies have failed to demonstrate a risk to the fetus, but there are no adequate and well-controlled studies in pregnant women. Warnings: methicillin, nafcillin, and dicloxacillin should be used with caution in patients with a history of allergic reactions to penicillin or other beta-lactam antibiotics. They may also interact with other medications, so patients should inform their healthcare provider of any other medications they are taking. Drug interactions: methicillin, nafcillin, and dicloxacillin may interact with other medications, such as warfarin, which can increase the risk of bleeding, and oral contraceptives, which can decrease their effectiveness. Dose: the recommended dose of methicillin, nafcillin, and dicloxacillin will depend on the type and severity of the infection being treated. They are usually administered intravenously or orally. The dose may need to be adjusted in patients with renal impairment or hepatic dysfunction. The usual adult dose of nafcillin and dicloxacillin for skin and soft tissue infections is 500 mg to 1 gram administered every 4 to 6 hours. The usual adult dose of methicillin is 1 to 2 grams administered every 4 to 6 hours. However, methicillin is no longer commonly used due to its high toxicity. Thank you.